An overview of the trends of equity or inequality in health in particular during the last decades. So how our countries have been going through that.
If we look globally, there's been a very positive movement over the last decades of reduction in inequities. And by that, I mean that poorer countries have had remarkable improvements in health, which has been very reassuring, a great development that I think a few years ago we passed a watershed where the biblical 70 years and 10 life expectancy applied to the whole world. We reached that longer than 70. And now there's still significant differences of countries that are way below the 70 and others doing better. But for example, when I began the WHO Commission on Social Determinants of Health in 2005, there were countries with life expectancy in the 40s. And that's not, whereas in Japan, it was in the 80s and nearly 40 years spread. Well, that's got a bit smaller. There are countries in the 50s now, but not in the 40s. Now, it's still a 30-year spread. So that's still enormous, but it's not a 40-year spread. So the global inequities in health have got smaller, and that's a very good development. I'm just not talking about the pandemic.
Yeah, sure. Yeah.
Whereas in many rich countries, what we've seen over particularly the last decade and maybe a bit longer is an increase in inequalities, in inequities. And we've seen it in Nordic countries, which we think of as being very egalitarian. We've seen in Sweden an increase in inequalities in life expectancy. We've seen it in the UK. We've seen it in the United States. In many countries, we can see this increase in inequalities between socioeconomic groups.
Exactly.
What we're also now seeing is increased attention to ethnic inequalities. In the United States, for example, for a very long time, they didn't look at socioeconomic inequalities. They only looked at racial differences. And to put it in perspective, let's say between 1870 and 1970 in the United States, the racial ethnic differences got dramatically smaller. Black life expectancy improved much more rapidly than did white life expectancy over that 100 years up to 1970. That's less clear over the last period.
I'm pretty sure that there are many answers to the question I'm going to pose, but can we identify some social determinants, some economic determinants, some factors that are more important or that weigh more than others in either shrinking these sort of trends or widening it?
To make it concrete, let me give you the example of the United Kingdom, because I'm interested globally, but we've done so much analyses and we've got very good data. And the big problem is lack of data on social determinants of health. So in a country like Britain, we're blessed with high quality data. So I can talk about it. In 2010, in the wake of the WHO Global Commission, I was convened by the British government to look at health inequalities, as we called them, health inequities, and social determinants of health, and to make recommendations of what we could do. And we identified 6 domains that are important as causes of health inequities and as areas for recommendations: early child development, education and lifelong learning, employment and working conditions. Number 4 was everybody should have at least the minimum income necessary for a healthy life. That's pretty radical. People should have enough to buy food for their families. So that's really radical. Number 5, healthy and sustainable communities in which to live and work, including housing and communities. And number 6 is taking a social determinants approach to prevention. So in other words, not just saying you should eat more healthily or you shouldn't smoke, but recognizing that there are social determinants of people's healthy behaviors. And we think those 6 are key as causes of health inequalities. And as we watched what happened in the UK in the decade after 2010, health stopped improving, health inequalities got bigger, and life expectancy for the poorest people went down, got worse. And I think much of the explanation lies in those 6 areas.
That's super interesting, even considering how you applied that kind of view and that kind of data to other situations, I suppose, right? So one of the key questions is whether should we work to reduce the inequality or should we work to improve the general conditions of the population? Not necessarily these 2 things go together, or am I wrong?
So the answer to should we do this or should we do that is yes.
Oh, to both. Yeah.
We should do both. We do not, and I have to say this because some joker will always say you could reduce inequalities in health by making wealthy people sicker. And we do not want to do that. That is nowhere any part of our agenda to make any group of the population sicker. Absolutely not. We want everybody to get healthier, but we'd like catch up. Health follows the social gradient. The more deprived the area in which people live, the shorter the life expectancy. We'd like leveling up. We'd like catch up. The poorer you are, the faster we'd like to see the improvement. So it's not acceptable to say, oh yeah, average health is improving, but inequalities are getting bigger. That's not acceptable. It's likely that the 2 go together because if, let's say, the bottom half of the population aren't improving, then the average will improve more slowly. So the 2 are likely to go together.
Is that possible that we also kind of, thanks to this data, thanks to these studies, have changed our perception with regard to the weight of different factors in the development of health and in the leveraging effect of some of these policies? What I mean is, for many years, we have been under the perception that being wealthy and rich was obviously per se a condition of health. But then we also said for many years, we observed the fact that, for example, a big issue is related to overeating, or eating too much food is also an issue, and the poor people do not eat enough and they are unhealthy because of that. These are very simple perceptions, and I think the data actually contradicts some of this perception. Do you think that we have been improving our ability to read this data in a more complex and more meaningful way?
Oh, no doubt about it that we've got better understanding, and that it's not simply a matter of money. Let me give you slightly out of date data, but they're not very out of date. The message is the same, even if the figures are slightly wrong. If you look globally at the graph linking national income per person to life expectancy, what you see is what the Canadians call an upside down hockey stick. So it's very steep at low levels of income. A small increase in income leads to a big increase in life expectancy as a country. And then you get up to Costa Rica, Cuba, Chile. Costa Rica has national income of around $17,000 per person, adjusting for purchasing power. Now, at the same time that I was looking at this, I was looking at the US city of Baltimore. And you don't have to adjust for purchasing power because the US is the standard. In the poor area of Baltimore, household income was $17,000, the same as the average for Costa Rica per person. Life expectancy for men in the poor area of Baltimore was 62. In Costa Rica, it was 77.
That's a
Now,
gap.
this is adjusting for purchasing power. So in other words, it's not just income, because you could say, that if you and I went to the poor part of Baltimore, what we would see would be very distressing. We would see houses with red crosses on the door because they've been condemned as unfit for human habitation. We would see people hanging around on street corners because of the unemployment. If we were very perceptive, we could witness the drug dealing going on. And if we stayed around, we'd see police violence, police arresting young Black men. We would see all sorts of signs that says this is a poor community in the US context, even though in terms of purchasing power, it's identical to the Costa Rican average. And the Costa Rican average life expectancy for men is about 15 years longer than in the poor part of Baltimore. So what we've understood is money is very important for health if you haven't got any. You need enough money to pay the rent, to buy children new shoes, to get them a replica football shirt that says whoever your favorite footballer is. That's important. That's part of having a healthy life. You say, surely that's an indulgence, buying your child a football shirt with your famous football hero on. No, it's not. That's an essential. That's an absolute essential. How can your child go out in public and hold his head up if he hasn't got the latest football shirt? He's an outcast. So recognizing that you need enough money to participate in society as a respectable member of society. That's been a real insight. But you don't need more money than that to be healthy. You need access to the social benefits of society. And now, if the only way you get those benefits is to have high income, okay, you need more money. But if you can have access to transport and education and a safe living environment and decent housing, because those are provided at affordable prices to everybody, then having bigger income isn't the key driver of your health.
Does that mean that when we are working to improve health, different health parameters, or the global concept of health, should we really connect data from many different areas and many different sources? It's like as if we're not talking about health as a biological condition anymore, but we're talking about health as a much more complex and holistic concept. Is that true?
Thank you. Welcome to my world.
Thanks.
Welcome. Well, I welcome you in. That's what we do. That's what we do by recognizing that people's health is very much influenced by the conditions in which they're born, grow, live, work, and age, and by the structural drivers of those conditions, macroeconomic and social impact, the environment, politics, culture, and society. That's the social determinants of health. And if you recognize that those social determinants of health are what's driving health and health inequity, then you've got to engage with economics and psychology and education and environment and transport. These are all important. And when it comes to policy, it's not just for the health ministry, it's for education and environment and transport and the finance ministry. All of these are important. I mean, I've got an editorial being published this afternoon in the BMJ, the British Medical Journal, with the challenge we've got a new health secretary, the senior minister in the health department. And I'm saying this is your challenge, not just the problems in the healthcare system, not just dealing with COVID, but dealing with the fact that we're not very healthy as a country. We're not doing well. And to address that, you've got to work right across government.
Just today, we got the result of the educational comparison at the European level. So the result for the Italian schools, the tests that are done every year. And we got, I was just going through the first results. There was a press conference this morning, and the impact of this last year of school with up and down, closing and opening and all of that as being enormous. So that's actually a question I wanted to go to, which is not so much the impact of the pandemic per se. Okay, of course, I want to have your take on that. But also, I would like to ask you if you can give me your idea from the data and from all of that we've been discussing. To deal with the impact of the pandemic, shouldn't we really have a much more complex approach? I got the impression, certainly in this country, we also try to face that in a separate way, the health ministry and the health issue, the environmental, of course, the economic one, the education. But what I feel it's lacking, maybe it's a wrong perception, is a much more complex and integrated approach.
One of the problems with the pandemic is that some governments have seen it as the public health or the economy. It's the wrong approach. The Financial Times, the business newspaper, published a graph last year showing that the countries that had handled the pandemic well had a smaller economic hit. So if you worried about the economy, you don't open up and forget the pandemic. You control the pandemic in order to open your economy. So if you're in South Korea or Japan, well, Japan, look how cautious Japan. I mean, look at the difference between Japan and the UK. The final of the football had 65,000 people in Wembley at a time when the doubling time for COVID-19 is 9 days, when we've got 35,000 cases a day and the doubling time is 9 days. And Japan has now said no spectators at the Olympics. You can imagine that the Japanese government and lots of people in Japan said, our financial future depends on this. We need the spectators and we need the visitors but they've said COVID doesn't allow it.
My last question is about the biggest crisis, which is the climatic or crisis, right? Which I think in terms of long-term impacts, I expect to be even worse than the pandemic, right? What's your take on that and the effect on, again, global health?
Had there been no pandemic, what I would have said is that there are two crises that we have to confront at the same time: the climate crisis and the inequality crisis. We need to confront them together. Had there been no pandemic, that's what I was saying. Then there was the pandemic. And I'm still saying that we've got to confront the inequality crisis and the climate crisis at the same time, which is why I've called my reports Build Back Fairer, not just Build Back Better, but Build Back Fairer. Sorry, to continue a theme, I'm really not obsessed with sport. But on the 30th of June, the front page of The Guardian had two stories: England 2, Germany 0, and the drop in life expectancy in Greater Manchester was jaw-dropping, said Professor Michael Marmot. So the two stories, as one friend said, both stories were jaw-dropping: England 2, Germany 0, and the drop in life expectancy. It was jaw-dropping. 1.6 years drop in life expectancy for men in Greater Manchester, 1.2 years for women. Now, so the pandemic had a huge impact on the pre-existing inequalities. But as we build back fairer, it has to be done at the same time as dealing with the climate crisis.